Ayan. Okay, good afternoon, everyone. We will be reporting about obsessive, compulsive, and related disorders. So, I am with Ma'am Mika May Ariola. So, originally, this OCD is under the category of anxiety disorders, but now on the DSM-5, it is classified into another category. That's the name OCRD. This time, okay, so we know that OCD actually is a clinical disorder wherein it is characterized by preoccupations of obsessions of thoughts and what we call this repetitive behaviors that are actually considered as illogical or unreasonable. So, uh, okay, I think we are familiar when we say obsessions in OCD. This comprises the ideas or thoughts, urges, impulses, images that are actually anxiety-inducing thoughts. So compulsions may include, checking, touching, ordering, such that. So these two, obsessions and compulsions, are actually time-consuming. So for the person experiencing OCD, they may spend 1 to 3 hours for this for obsessions and compulsion. So with that, it leads to distress and impairment in their functioning. So, let's go here. So, gumawa kami ng Venn diagram ni Ma'am Nika to identify the similarities and the differences of the occurrence of OCD among adult, children, and youth. So, as we can see here, for the adult, they may recognize that their behavior is problematic, while for the children, they will have difficulty acknowledging these behavior, compulsions, and obsessions that they are abnormal. So the difference is due to the several developmental factors. For instance, for the children, we know that as compared to adults, they have underdeveloped cognitive abilities. So as a result, the distress that they are experiencing from the obsessions and compulsions lead to tantrums and angry outbursts. So for the children and youth, okay, so similarity, they may both not understand that their behaviors are abnormal. So for the youth, increased amount of distress may lead to increased magnitude or intensity of compulsions. So as a result, they may be reluctant to go to school, and they may, due to embarrassment, and they may actually also withdraw from social activities. So for this one, as we can see here, youth also have higher risk for comorbid anxiety disorders and depression. So, ayun nga po, the similarities among youth, children, and adult are the distress that they are experiencing for the repetitive behaviors or mental acts. Okay. And so, we can see here the seven categories of the OCRD. So, we may actually add here the OCD specified OCD and unspecified OCD. So these categories actually leads to elevated anxiety and amount of distress they are experiencing. So we will actually discuss each of this. Okay, so let's go to the OCD. So OCD comprises, of course, mental acts, as we can see here, bimodal. That means some individuals experience onset of OCD symptoms when they in childhood, so mas maaga. For normally, according to studies, it exists on the average on 10 years old. And for some individuals, they may experience this on a later onset of symptoms, such as 21 years old na nila nararanasan yung OCD symptoms. So, there is also difference between female and male. So, kanina sa mga past reports natin, mas prevalent nga na sa females yung ibang disorders na nabanggit. So, the same with OCD, female are highly affected than males in adulthood. But in during childhood, males are more actually prone for the OCD symptoms. So, aside from that, meron ding difference on gender-related diagnosis. For example, as we can see here in the GIF, so yung cleansing, in cleansing dimension, mas nag-occur siya among females than in males, while these sexual fantasies like that, yung mga thoughts na ganun, mas nag-occur siya more on male, according to studies. Okay, so it may be comorbid with anxiety disorder and depression. Okay, so now let's go to the next category, Mom Nika.
Thank you, Miss Christine. So, I will be reporting the following OCRD or the OC-related disorders starting from body dysmorphic disorder. First, apologize po pala, hindi ako makapag-open cam. So, currently, masama pa po yung pakaramdam ko and medyo paus din yung voice. So, again, for body dysmorphic disorder po, the difference in OCD is that ang kanila pong obsessions or persistent thoughts ay nakafocus sa physical appearance. So for BDD, it can be one or more persistent or intrusive thought about physical appearance, and then yung compulsions nila ay appearance related din or yung rituals. So mostly ang rituals ay checking sa mirror or reassurance sa ibang tao, like nagtatanong-tanong kung kamusta yung itsura nila o parang nire-reassure nila yung sarili nila, or they can also skin pick. Pwede silang mag-pick ng skin. And yung PDD po, most common is na features na napapansin is yung sa nose, sa face, and yung skin. At the same time, common din po na i-compare nila yung sarili nila sa ibang tao for BPD. And then ang onset po, typical age mostly ay 14s or adolescents, 12 to 13, and median ng 15 years old. May comorbidities din po siya in major depression, social phobia, and substance use disorders. So next, ma'am. For hoarding disorder naman po, nag-appear na po ba?
Di ba?
Ayan po. For hoarding disorder naman po, merong excessive acquisition of items. So dito, meron kasing OCD na ang obsession niya ay for completion. So yung ganon, nag-hoard sila ng items in order to complete parang a set of things. Meron kasing need to complete things. So under yun ng OCD, yung ang obsession or persistent thought nila ay completion, to complete a set of items or mangolekta na mangolekta. In hoarding disorder, the difference is merong difficulty in discarding possessions. So, hindi naman specifically na need niya na makomplete ang isang set of items. In hoarding, may difficulty in discarding possessions. And ang difference niya sa normal na pangongolekta or yung mga collector is that in hoarding disorder, they are ashamed or nahiya silang malaman ng ibang tao na meron silang items na hino-hoard. And mostly sa mga collectors, di ba, naka-arrange pa siya, nasa frame, nasa organizers, di ba, dinidisplay. In hoarding, syempre, di siya naka-arrange, nagka-clutter lang siya sa area, tapos nagkakos na siya ng distress, and yung hindi na kumbaga, hindi na kaaya-aya yung bahay tignan, hindi na kaaya-aya yung amoy, ganun po siya. So, hoarding disorder. So, symptoms, ang onset din niya is mostly on teens, and mostly nag-i-interfere with mid-20s. Comorbidities in body dysmorphic, pwede din po sa schizophrenia, dementia, eating disorders, autism, and intellectual disability. Excuse. So, for trichotillomania, next slide po. trichotillomania or hair pulling disorder, it is also called a habit disorder naman siya. So, it can be automatic or focused. Pag automatic kasi, without full awareness, it can be caused by boredom. So, habang nanonood ng TV or may ibang ginagawa, nagpo-pull ng hairs in different parts of the body. So, without full awareness siya. Pag focus naman, nangyayari siya kapag merong triggers like merong stressful situations or may nag-trigger na event. So again, it can be automatic and focused. In hair pulling disorder, it can be in different parts of the body and hindi lang basta nag-hair pull. So pwede din na minamanipulate pa after ng hair pulling. So pwede ni-roll siya between fingers, nagbabite or sinaswallow. And then, it is typical during childhood or early adolescence. Next po, the excoriation or the skin picking disorder. Ma'am, na next na po.
Yes po, ma'am.
Okay. Okay, thank you. Excoriation or skin picking disorder, picking at one's own skin na pwedeng healthy skin siya and magkakos siya ng pwedeng lesions or calluses. So, it can be done with fingers and tweezers. Same siya ng trichotillomania na merong automatic versus focus. And yung nabanggit ko kanina na merong BDD na pwede ding nagsiskin pick, but the difference is that in BDD na merong skin picking, ang purpose or intention po nila ay to improve the perceived imperfection sa physical appearance. Kumbaga, the skin pick kasi pakiramdam nila pangit yung pimple sa mukha nila. Dito po kasi sa excoriation, ang skin picking is to relieve anxiety or to release tension. Kumbaga, hindi siya for physical appearance. And also, nakalimutan kong banggitin sa BDD kanina, the perceived imperfections or defects can be slightly observable or not observable to others. So again, ang onset po niya ay during adolescence. But the mean dun sa mga nare-report na studies na patient age is 30 to 45 years. It also has its comorbidities na mostly pag may excoriation, may trichotillomania din, but it doesn't mean na magkasama siya lagi. And OCD and major depressive disorders. Next po. Miss Christine?
Yes, ma'am. Okay, so next is OCRD due to other medical conditions. So for this one, the OCD symptoms occur at the onset of the existing medical disorder. So this is exactly the pathophysiological consequence of having that other medical disorder. Well, of course, it should be from evidence from the laboratory findings, so physical examinations conducted. So for example here, we have the compulsive skin picking. So it can be actually a result, for example, of having anemia. So according to my research, so pag may anemia is can be caused by poor regulation or poor circulation, oxygenation, such that. So it can lead to itching and sensation. So that will lead to actually a compulsive skin picking. So that's the OCRD due to other medical conditions. And this one, Ma'am Nika?
Next po is the substance-induced or medication-induced OCRD. So, kagaya din siya sa ibang disorder na mayroong substance-induced, the symptoms appear during or soon after intoxication or withdrawal from a certain substance or medication. So, yung OCD symptoms should be, pag nagda-diagnose nito, kailangan i-check na kung meron bang OCD symptoms before pa gumamit ng substance. And if the symptoms persist after the abstinence or yung matagal na talagang wala yung substance, pwedeng hindi siya substance-induced OCD or OCD na siya talaga na diagnosis. And then next, ma'am.
Alright, so Ma'am Nika?
Next po,
Yes,
ayan.
ma'am.
For
Causes.
causes for causes of OC disorders, genetic causes. So, it is very well known in twin and family studies na kapag po meron tayong relatives, especially first degree relative na may OCD, mas malaki yung chance na ma-inherit. And at the same time, meron pong studies na nagsasabi na kapag ang onset ng OCD ay nag-start ng teens, malaki yung chance na inherited or galing sa genetic yung cause ng OCD. For autoimmune related causes naman, may tinatawag tayong PANDAS for children, the pediatric autoimmune neuropsychiatric disorders associated with streptococcal infection. So, meron pong cases na after magkaroon ng streptococcal infections like strep throat, H1N1, flu virus, Lyme disease, nagkakos daw po ito ng OCD symptoms at least within 24 to 72 hours. This is very sudden and nawawala din pero pwede siyang bumalik at a later time. Next slide po. Na-click na ma'am. Okay. For behavioral naman, it is known din na at some point, pwedeng yung behavior daw po is parang nalelearn kasi merong perceived thought kasi sa isang tao. So, parang meron siyang fear na nagkakos ng stress. Nalelearn din daw yung behavior na every time na merong thought na ganon, meron siyang compulsion or behavior na ipapakita or to prevent the perceived intrusive thought na naiisip. In cognitive naman, nagkakaroon ng parang misinterpretation of your own thoughts kasi nga po, there is a persistent thought na paulit-ulit or hindi siya mawala, repetitive siya. So, ang tendency, yung behavior mo, naka-anchor doon sa persistent thought na yon. So, nagkakaroon daw ng misinterpretation ng thought. In environment naman po, certain life stressors or triggering experiences na nagkakos ng OCD. So, most common daw po sa girls ay yung postpartum or after giving birth or pwedeng may complications during pregnancy and after birth. Pero pwede din naman po yung ibang stressful experiences in life. For treatments naman po, next ma'am, Miss Christine.
Ito po. So, makikita po natin dito yung table ulit na ginawa namin. So, as we can see, most of the categories of OCRD, the treatment used will be the cognitive behavioral therapy. But behavioral approaches and pharmacology are actually proven to be effective, but mas effective daw yung behavioral approaches. So, the gold standard for treating OCRD will be CBT. So, there is also here a category for habit reversal therapy. For example, sa excoriation and hair pulling disorder. So, in habit reversal therapy, dito, yung mangyayari is the individual suffering under this category will be taught another or new skill para pampalit niya doon sa compulsion na ginagawa niya in order to release the obsessions or the preoccupation of obsession. So for example, sa hair pulling disorder, instead na for example, magpupul ka ng hair na ganyan, ang gagawin, i-close mo yung fist mo para ma-prevent natin yung hair pulling disorder na ganyan. So, mas magiging better na ngayon yung condition. Kumbaga, mas ma-lessen yung yung compulsions. And then for the OCRD due to another medical condition and substance or medication-induced OCRD, we classified it on the unknown kasi some studies actually said na the treatment for these two are actually challenging. For example, for OCRD due to another medical condition, mawawala lang yung OCD symptoms kapag nawala din yung medical disorder na meron ka. So, ganun po yung mangyayari. But for some, effective din ang CBT, application of CBT and medications. And for the last one, sorry. So this one, in-include na lang din namin ang medication. So we have the selective serotonin reuptake inhibitors. So it can this is a type of antidepressant that can help treat OCD. So we have here listed five. So we have Lexapro, Luvox, Paxil, Prozac, and Zoloft. But actually, medications, especially sa child, this is usually avoided and can only be used as a last resort kasi mas okay pa rin daw ang psychotherapies according to studies. So that will be the end of our report po. Thank you so